Hi everybody, this is John Linkous, the CEO of the American Telemedicine Association. I'm really sorry I could not be there with you today. At least I want to spend a few minutes and talk to you a little bit about telemedicine from the perspective of the American Telemedicine Association. So I have a few slides I'm going to refer to throughout it. What I really like to talk about is telemedicine in times of change, because we are in a tremendous time of change right now. And the question is whether it's opportunities or a threat. The ATA's mission has been transforming the delivery of healthcare via telecommunications technology to improve quality, access, equity, and affordability. And it's a very global view, but it really reflects the perspective of all of ourselves. So when I talk to a lot of people in healthcare, I usually ask them to raise their hands and how many of them have actually done telemedicine. And only a couple usually do. But then I say, well, how many of you use the telephone to talk to your patients? And of course, everybody answers, yes, I have. So my answer is, you've all used telemedicine. Because really, when you get right down to it, telemedicine is using telecommunications technology to help patient care. The telephone is the first way. We've been doing it for 100 years. Now we have other things like the internet and email. And then, of course, we have video like what I'm doing today. So there's a lot of things that are changing in telemedicine, a lot of things that are moving throughout the world as we speak. But as we move ahead and as things change, what we will find is that really the reality is providing care to patients is just the same as it always been. We just have new tools to provide that care. And change is not new, certainly not new for technology. For example, if you look at some of the technologies that we use today, cell phones, 30 years ago, we didn't have cell phones. The internet is only 19 years old. Facebook, it's only 9 years old. iPad, many of you, hard for me to believe that 3 years ago we didn't have the iPad. That's all brand new. Here's another sign of change. I don't know how many of you used to see this picture when you had to cash a check and go to a teller. You don't do that anymore. We go to an ATM. You go to an ATM and you wouldn't think of going to a bank that requires you to go to a teller to cash the check. The same thing is true in healthcare. Look at bookstores. This is the way we all got books. Some of you may remember this. This is the way some of us still get books. But most people get books through things like Amazon. They have 850,000 titles, 615 million customers. People have gone automated. People have gone over the internet. This is the movie theater. Remember the movie theater? We still have them. Now Netflix, over 40 million subscribers. So we've had a world of change in technology, a world of change in so many industries, in entertainment and banking, in so many other areas that we have in a day-to-day life. 44 years ago was when we had the ATM, 19 years ago for Amazon, 16 years ago for Netflix. So changing in healthcare as well. And that's what telemedicine is. It's really just a tool to change the way that we provide care. So when we talk about it, let me talk just a little bit about where telemedicine is right now. Telemedicine is, we did a survey a couple years ago. We found that in 2012, approximately 10 million people in the United States had services provided by telemedicine. 10 million patients. The amazing thing is there's so much telemedicine going on today, people don't even recognize it. This is where it is. Of course, the largest share back in a couple years ago was in teleradiology, still a large share. Teleradiology is so widespread, the radiologists don't think of it as telemedicine. It's just the way you look at images. You don't happen to be in the same room. But the same thing is being true, and many of you know in the room, same thing is true for intensive care units, for stroke care at a distance, outsourcing mental health services. Somewhere around 300,000 people saw a mental health therapist last year remotely, and that number is only increasing. Internet clinical consults, cardiac monitoring, about 1 million patients a year have pacemakers or arrhythmia monitors monitored at a remote place. Most surgeries in the United States have someone monitoring the brain scans. If it's a spinal surgery or brain surgery, have someone monitoring that at a distance. It's the majority of cases. So there's a large amount of telecommunications already involved. And that's the one thing that I really wanted to leave a message from ATA, from a national perspective. This is not something new. This is not something that is really something that we haven't seen before. It's just something that we're using these tools in a different way. And we're going to be using these tools even more as we move ahead. And there's a lot of reasons for it. Let me talk a little bit about some of the drivers that are really moving ahead in terms of telemedicine, what I call the new faces of telemedicine. First of all, technology innovation. I've talked a lot about the changes that we've had in technology, certainly in terms of entertainment and in banking, but the same thing is happening in healthcare. Here, of course, anybody in healthcare would recognize the first image you'll see on the top left is the stethoscope. That's what was invented around 1820. Then we move to the one that people recognize is on television, the one to the right, which is the stethoscope worn by doctors. Of course, these days, you're talking about the electronic stethoscope. Down the bottom left, or on the right, you have the portable ultrasound, which some doctors, Eric Topol and a few others, are touting that that's the new stethoscope of today. So technology is new, and technology is not new. Back when the stethoscope was invented in 1820, there was a lot of opposition to it by a lot of medical societies and a lot of other folks, because physicians always put their ear on the patient's chest. This allowed them to actually hear the patient's heartbeat from a distance. In this case, the distance is maybe 10 inches, but actually could hear it better. And now we're just saying that instead of 10 inches away using the stethoscope, we're talking about maybe 20 miles away, or even better, in a better way, using an ultrasound. So there's a lot of technologies there, but it's not just in that area. It's in mobile health. Mobile health has been touted a lot. There's a lot of applications in it. There's a lot of hype in mobile health. But there's also applications in mobile health that people use every day, that doctors use every day. This is one of my favorite examples. When you go to a doctor, when you go to a pharmacy, they always double check your prescriptions to make sure that there's no interaction back and forth. That's done very handily by a lot of physicians on their handheld device. It's an electronic, wonderful device that's changed the life of healthcare. So we've really had a big change in the way that we've provided healthcare already. Healthcare has been transforming itself for the last 25 years in use of telecommunications technology. It's not just pilot programs anymore, it's not just demonstrations, it's something that has really come into effect. But it's a question of how far it goes and where we're going to go. So here's another aspect of it, technology-enhanced consumer empowerment. So for example, patient portals. Physicians are more and more moving to patient portals. My own physician, I have a new physician this year because my last physician didn't have a patient portal. And when I had to get my lab results, I had to call in the next week and had a recording of it. But my new one, where I think most physicians are moving pretty quickly between meaningful use and pressure from patients, is having all the lab results online. You can do the scheduling online. You can even see visits, email, or even a video visit with a nurse or some practitioner online as well, all through a patient portal. That's clearly where things are moving. In addition to that, we have online consults. There are several companies who are involved in providing these consults today. About 500,000 consults will be provided this year by the top 3 companies for online consultations. So it's clear that this is moving in a very rapid way. And at the same time, consumers are using their own cell phone to do their own health monitoring, or in this case, losing weight. Is one of the most popular applications for healthcare that's now available online, which is the Weight Watchers application, being used by an enormous amount of people. There's a lot of hype in healthcare, there's a lot of hype in mobile health, but it's really moving back and forth in a way that's really, I think, moving ahead. We also have changes in payment innovation. The way we deliver care is no longer, or it's still primarily fee-for-service, but we're moving more toward capitated care. We're moving toward a managed care environment. It used to be with ATA's top policy priority was greater reimbursement out of the Medicare system. Now we're saying as Medicare moves to capitated care, accountable care organizations, medical homes, we're now saying get the federal regulators out of the way and let the doctors and the patients get the care the way they need it and the way they want it. And if that happens to be by telemedicine, that's the way it should be. That's the way that healthcare has transformed in telemedicine. So delivery transformation, healthcare in so many ways has changed for years. I've talked about the remote intensive care units. This is a A service is provided in Texas for Texas prisons. This is a cardiologist that sees prisoners all day. He's never met many of them, most of them he's never met in person, but he provides very high quality health care for many, many years in Texas. Very highly touted program that provides services throughout the state. This is another example of stroke care. So there's a lot of happenings that's going around. But this is the one I wanted to focus on in the few minutes we have remaining. Big Med. That's one of the things that's really happening, and one of the things that's, of course, affecting the Henry Ford healthcare system as well. This is hospitals in the United States. A large number of dots over a large number of areas, many of them small hospitals, some of them large hospitals, but we have a huge number of them, but that's changing. This is the Cleveland Clinic. Cleveland Clinic, as of maybe 25 years ago, was one building, very wonderful building, one of the leading institutions. I said Cleveland Clinic, I'm wrong. This is a New York Presbyterian Hospital. My forgiveness for any of you who are from the Cleveland Clinic. This is a New York Presbyterian hospital. Beautiful hospital, one of the leading clinics in the world. But this is a New York Presbyterian hospital today, scattered throughout the state and actually into Connecticut as well, in multiple facilities. That's the way healthcare is being provided, through multiple facilities. This is Mercy Health, located in, they're headquartered in St. Louis, but they're actually over 4 states. About 35 major medical centers and 30 to 40 other clinics and hospitals throughout. Last week, Mercy Health broke ground on a virtual healthcare site. This is a virtual healthcare center, 20,000 square foot facility. They're putting all of their subspecialists in so they can provide appropriate care to all of their facilities throughout all 4 states out of one place using telemedicine. This is the top priority for the CEO and the board of directors. They are spending a huge amount of money of consolidating a lot of their specialty services, saving money, but also providing higher quality care throughout their 4-state region. And they're using this as a competitive advantage over other facilities, because now they're going to be able to also outsource a lot of their services to other hospitals in the region that are even outside of the Mercy Healthcare Center. Very smart application. This, many of you in the room would recognize, is the map of the Henry Ford Center and all the hospitals that you have and the clinics that you have throughout there. So, of course, all of this mixes into a tremendous opportunity, and that's the way I see telemedicine as an opportunity to bring higher quality care at a lower cost to more patients, particularly throughout your healthcare system. But healthcare systems are all changing. The Mayo Clinic now has affiliations with hospitals throughout the country. Cleveland Clinic does, Johns Hopkins. So many other hospitals are affiliating with others using e-care, e-consults as the Mayo calls it, or other types of remote cardiac teleradiology or telemedicine, as the Cleveland Clinic will call it. A variety of applications. Part of this is providing clinical care. Part of this is a natural change that we're seeing in the healthcare system. So all of this is happening all around us. Many of us don't necessarily see it as a threat. Many of us see it as an opportunity. So let's look at, just for a brief second before I close, about the threats and opportunities before us. This is one of my favorite movies, Robot and Frank. I don't know how many of you have seen it. It's a movie about a gentleman who gets older in life, and it's a science fiction movie, and his kids get him a robot that helps him with his daily chores and daily activities. And of course he resists it, but then later becomes totally enamored of the robot and loves him, and the robot loves him back, and they have this relationship back and forth. It's kind of a funny story, but the funny thing about it is we're moving gradually toward those types of assistants we have in our home. NASA is building a remote surgeon that they're going to be using. They're testing it out for use for long space flights. Places like In Touch, which is providing robotics in hospitals, are working with others, and other robotic companies are working on personal care robots to go into the home. How far we go, it's hard to tell. But here's one example, the X Prize. ATA is co-sponsoring the Qualcomm Tricorder X Prize. Some of you may remember from the days of science fiction, the tricorder, where you just wave in front of somebody and you can actually figure out all their different diseases. Well, this is a $10 million prize, and they have something like 20 finalists. And the prize goes to a company that can provide a device that's low cost, very consumer friendly, and you can walk up to the unit, and within a matter of a minute or a very short time frame, it'll diagnose up to 30 different diseases. There are a number of finalists on this. They hope to make the award next year. I don't know how close they're going to be, but it's amazing to see some of the instant diagnostics that they have. We all know places like Minute Clinic are now offering lab results inside the Minute Clinic as you wait. So all of this is moving very forward. The challenge for us is how quickly we can do this and how we can do it safely and effectively, keeping patient safety first. That is always a challenge for regulators, be they in the state, be they in the federal, or be they with associations like ATA. That's what we focus on. We focus on what we call the hospital of the future, which is made possible by telemedicine, and that's telemedicine into the home. So, very quick, broad brush in just a few minutes that I have with you, but I wanted to give you an idea of where we see telemedicine going, and it is going there very, very quickly. You may not call it telemedicine. Some people call it telehealth. Some people call it connected care. Some people call it mobile health. It doesn't really matter what you call it. It's all providing health care using telecommunications technology remotely. So I wish you well with the conference. Special greetings, and I hope all of the rest of you there are having a good conference and having a great day. And sorry I could not be with you, but I'm glad I could at least take a few minutes to chat with you. Thank you very much.